My name is Karen Wilde. I was diagnosed with multiple myeloma in May 2012. I was actually working as a physio in private practice, and I'd had a couple of bad luck accidents, really. Got knocked over by a horse float, which led to a serious foot injury and a total hip replacement. I didn't come out of it too well. I thought I should be able to jump out of bed after this, and I didn't. So that was flag one. Flag two was I had unusual knee pain on the side of the hip, which I'd never, ever had. It wasn't my regular GP. She said, it looks like you haven't had your regular blood tests, just as a checkup, your checkup. And so I said, okay, if you've got time, I've got time. She said, it looks like you've got myeloma. And I thought, oh my God, I think it was melanoma like a lot of people do. And she said, you're going to have another blood test. Anyway, when I spoke to my regular GP, she said, I wouldn't have worried about that. So anyway, I wasn't really so I thought I put it in the glove box of the car and passing, and I thought, shall I, shan't I? Yes, I'll better do it. And had this other blood test. And of course, when I went back, she said, well, you're going to have to see a hematologist who is a friend of mine. And of course, it all went from there. The family had to come in, and so it was a bit of a shock, really. And I think summed up by the fact that the hematologist said to me later, he said, well, if somebody like you can get myeloma, he said, it shows the indiscriminate nature of the disease. Number one, thank God it was me and not my husband or one of my 4 children. So that was the thing. I felt I had skills to deal with it, and why not me? I was working. I carried on for another year. I was set up a women's health clinic, actually, that I'd had in private practice, and that I was able to hand that on. And I did hydrotherapy, but I started realizing that the patients, I was worse than the patients I was treating. So, and John said to me, look, John Hounsell, the hematologist, said, keep your rhythm of life. And then I started to get some infections at the back of my knee. And I said, is it time to stop? And he said, yes. And then I just decided it was my old life I had to leave behind, and this was my new life. I got a lot of sinus issues that I never had before getting myeloma. And, learning to sort of act on something. If you get a temperature, you've just got to not ignore it. You've got to go to the emergency department. And, a couple of times I ended up in hospital on IV antibiotics. I use ski poles, those hiking poles to walk with now, and I don't have any problem with it using something, because I've got a drop foot on the right side, so you get low ferritin, so that's your stored iron. So you often have to. So I'm going to be now in future more closely monitored with regards to that. I had to have packed cells last time I was there, just before Christmas. So that's one. And then every osteoporosis is a second side effect of myeloma, and you need to have bisphosphonates every 3 months by infusion. And then, of course, I had got teeth problems, and so therefore you can't have your bisphosphonates. So luckily I'd had it that you have to have that every 3 months from the beginning of your diagnosis. And so I had to stop. Luckily I'd had because I'd had it for 8 years or something, I was able to have a year off while I had my teeth attended to. and then went back on it again just recently. So just those were some of the other sort of difficulties. So you've got appointments upon appointments upon appointments, but you get used to it. And look, everybody's individual. You have different, but I think you're learning to recognise when you're not well, and you have to become your own advocate, and not sort of sit around waiting. So yes, you've got to spend a lot of time in doctors' waiting rooms. So I just had all the treatments that were available to me locally. So in 2019, I started on the DREAM-M6 study after I'd had stem cells. So you have to have your stem cells collected first. Then it was a phase 1-2 study, and I was on that for 43 weeks. The side effect was eyes. You got keratosis. So you could turn up I had to have treatment twice a week, so I had to stay in Melbourne for the whole week, because traveling back was 3.5 hours was not really, possible. It's possible, but ridiculous. So I stayed. And then, of course, if you had to see the eye specialist before treatment, and he would say, yes, you've got no keratosis, yes, it's there, you can't have treatment. So it was very tricky. So it was barely a month, I think, and then it started again. And I've been on it's called the TCD 15484 study. And I've now completed 40 cycles of that. And I started on December 19. And I have, in addition, pomalidomide and dexamethasone. So dexamethasone is weekly, and pomalidomide is a 21-day cycle. The Dexa, I'm quite red and flushed in the face because I had the Dexa yesterday, whereas I started off on 20, which wasn't very pleasant. I felt very nauseated. So I got down to, I can't remember, say it was half that, 10 milligrams. But the drop from 10 to 2 was horrendous, joint pains. I don't want to go through that again. You get, increased hair on your face, which women can deal with. You get skin, thin skin. You get bruising. You have to be careful, and very careful in the garden. Knocking yourself, be clumsy, all those things. But, they're all things I'm managing. Bloating in the tummy. But, I have to keep the bowels going, and I've worked all of that out. I'm just very grateful that I'm part of the big picture, that, that these drugs aren't available on the PBS. And so they're not available for people who, perhaps reach the end of the road. And, you to be part of that is history, and be part of the medical, what's the word I'm looking for? Being part of a trial and helping people be able to access that in the future, then I think I'm quite privileged. When I first was diagnosed, your longevity was 5 years, Now, here I am, 12 years. So, I might get 20 years, but I might not die of myeloma thanks to trials, but it's the unknown, I suppose. And emotionally, I deal with it through my yoga practice. I think that there's some exciting things ahead, but it would be nice to think that you don't have to have a standard. The standard of care is raised a bar, if you like, by the fact that people will invest in further clinical trials, so people like myself can live a longer life. when you go back to, you know, 38 people a week being diagnosed, you know, and their lives are changed forever.